Thank you, Sahani sir, and all those participants in this session. Good morning, good afternoon, and good evening. Welcome to the 1552nd day of continuous and uninterrupted Zoom session of IFPH. Let us start today's program with a silent performance. Thank you and welcome back. Today, our guest is Dr. ROZMI MEMON, MD, Associate Professor, Head of Department of Obstetrics and Gynecology, Sri Shalmalji Homeopathic Medical College, Godhra, Gujarat, India. With 18 years of clinical and teaching experiences, consultant physician, Care Clinic, Godhra. Published articles, Homeopathy act as a surgical knife in case of renal calculi. The neurosis and homeopathy, July 2022 in HFH. Therapeutic utility for management of gallstones in HFH in July, April 2023. Leukorrhea and homeopathy in vital reformer, fibroadenoma of breast and homeopathy, another journal article. The topic is polycystic ovarian disease and its homeopathic management. We know the relevance of the polycystic ovarian disease, PCOD, and its contemporary importance. A lot of ladies are suffering from this disease, and the total humanity will suffer if the things go in this way. So definitely we need a safe medicine, effective medicine to cure such conditions. So on behalf of IFPH, and welcome, doctor. You can have the platform for next 40 minutes. So we should have a discussion regularly after 15 minutes. So kindly conclude in 45 minutes. Okay, doctor, please raise your hand. Now you are the co-host. So kindly join 5 minutes ahead of the schedule so that we can already make the arrangements. Yes, now you can proceed, Doctor. Samir Memon, please proceed. Dr. ROZMI MEMON, are you there? One person joins name of Samir Memon, isn't it? Dr. ROZMI, are you there? Please raise your hand. Now timings, in fact, nobody can believe that such a sharpness or accuracy you're always maintaining for the last 1552 days. Yes, please proceed. Yes, yes.
Yes, sir.
Are you using two devices? Then you please kindly mute all
Thank you
devices.
very much, sir. Thank you very much, sir. Are you hear me, sir? Am I audible?
Yes, yes, please.
Okay. Good evening, sir. Good evening, everyone. First of all, I would like to thank Dr. Dhanesh sir, Dr. Manoj sir, and all team of IFPH group to give me opportunity for today's webinar. And I would like to thank to Dr. Hina madam, Dr. Samir sir to always support me. And today I would like to start my session. Can I share the slides, sir?
Yes, of course.
So today's my topic is PCOD and its homeopathic management. I have been selected this topic due to its increased prevalence in today's world, as well as no definite cause is present for these diseases, but is somehow related with the psychosomatic or lifestyle disorders. Again, there is no definite treatment is available in any other mode of treatment except hormonal pills, and which will later on causes side effects and many harmful effects on our body. I hope today's topic will be helpful for all for the management and understanding of this topic. Here, I would like to give some brief about the topic, which would I like to cover during the whole session. That introduction and prevalence of PCOD, difference between PCOS and PCOD, its psychosomatic cause behind increased ratio, pathophysiology, clinical features, role of homeopathy in PCOS, case study and management in PCOS. So What is PCOS? It is a hormonal disorder. It is a disease of ovary, and it is a hormonal disorder that defined by the imbalance of reproductive hormones, which causes a variety of symptoms and health problems. It primarily affect the ovaries, and as we all know that female reproductive system, which consists of cervix, ovaries, fallopian tube, uterus, and vagina. First of all, whenever we have to understand the disease, we have to understand from the bottom. So we would like to start from the ovary, and its function. So first of all, I would like to say, or I would like to talk about the functions of the ovary. And the ovary that is responsible for the oogenesis, hormonal secretion, follicular development, and it will also suppress the fertility. By means of oogenesis, that ovaries that release mature ova during each menstrual cycle, and it is also responsible for the production of the female sex hormone, that is estrogen, progesterone, inhibin to regulate menstrual cycle, and which maintain also hormonal balance. It is also responsible for the follicular development, that means maturation of the follicles and formation of the follicles during the time of menstrual cycle. These ovaries also support fertility and coordinate with the uterus to prepare for the implantation and pregnancy. Now, next we have to understand what is the normal ovary. And in this normal ovary, first of all, primordial follicles are formed, which are converted into primary follicles. Primary follicles that are converted into secondary follicles, and secondary follicles that are converted into mature follicles. After that, formation of the mature follicle, that means Graafian follicle. These Graafian follicle gets ruptured, and ova, or ovum is released, and that produces ovulation. After these ruptured Graafian follicles, that is converted into the corpus luteum and corpus albicans. But this is for the normal ovary. But in cases of the polycystic ovary, these primordial follicles that is converted into primary follicles. But this primary follicles that is not converted into the further follicles, but they leave the multiple immature follicles. And this is the scenario or picture of the polycystic ovaries. Now we have to understand that PCOS, polycystic ovarian syndrome, and infertility, because ovary that is the primary female sex organ which release ova, and that is responsible for the fertilization. So here PCOS in many cases, approximately 70 to 80% of women with PCOS that causes infertility at some point due to the irregular or absent ovulation. Next, or vice versa. In cases of the infertility, in 100 out of cases of the infertility, around 20 to 30% cases, they causes PCOS. That means in cases of the infertility, that is also responsible for the occurrence of the PCOS, and PCOS patient, they are also causes infertility. Next, incidence. The global prevalence of polycystic ovarian syndrome is also increased, and that has been 5 to 15% among women of reproductive age. According to current research, globally around 1 in 10 females of reproductive age are estimated to be affected by PCOS. Next, I'll cover the difference between the PCOD and PCOS. I would like to say that PCOD, that is the initial stage for the disease condition or polycystic ovarian disease. But PCOS, that has been the later stage for the occurrence of the disease condition. And there is some sort of difference between the PCOD and PCOS. Definition for the PCOD, that is a hormonal imbalance where the ovaries release immature or partially mature eggs. Whereas in cases of PCOS, There is a metabolic and endocrinal disorders that affects all over health, which causes multiple cysts in the ovaries along with the hormonal imbalances. Severity and occurrence PCOD is less severe than the PCOS. Causes PCOD somehow associated with the lifestyle factors like poor diet, lack of exercise, and stress. Whereas in cases of the PCOS, that has been more complex origin and that involves genetic predisposition and systemic hormonal disturbances such as elevated androgen, like elevated androgen, that means male hormones. Next, symptoms of the PCOD, that is irregular menstrual cycle, mild weight gain, occasional acne, and hair fall. Whereas in PCOS, symptoms are irregular or absent periods, excessive facial or body hair, that is hirsutism, severe acne, significant weight gain, and last is insulin resistance or type 2 diabetes. Health risk for the PCOD that doesn't cause any serious or long-term health issues. Whereas in cases of the PCOS, that is been increased risk of infertility, type 2 diabetes, serious diseases, and endometrial cancer. Next, treatment for the PCOD that requires only lifestyle modification like healthy diet and regular exercise, and medication for the menstrual irregularities if it is required. Whereas in cases of the PCOS, comprehensive treatment, which include hormonal therapies, insulin sensitizing agents, and lifestyle changes are required. PCOD fertility, women can usually conceive with minimal intervention. And in cases of the PCOS which require fertility treatment due to anovulation or other complications. Next, there are some different types of PCOS. So here there are four types of PCOS, that is PCOS type A, PCOS type B, PCOS type C, and PCOS type D. These all four types that depends on the level of the androgen, ovulation, and cysts. In type A or full-blown PCOS, there is an increased level of the androgen or high level of the androgen. There is a problem in the ovulation and cysts are present on the ovaries. All three are present in type A. Whereas in type B, there is an increased level of androgen as well as problem in the ovulation, but no cysts are present. In cases of type C, there is increased level of androgen along with the cyst on the ovaries, but there is no difficulty with the ovulation. In type C and last one, that is problem with the ovulation, cysts are also present on the ovaries, but androgen levels are normal over here. Next, psychosomatic cause behind the increased ratio. So here there is no definite cause is present for the occurrence of the PCOS, but increased equivalence of female roles to male roles in society, where women are expected to perform in both professional and domestic sphere, has contributed to an increased ratio for the prevalence of the PCOS nowadays. There are some factors which are responsible for the occurrence of the PCOS are sedentary lifestyles, psychological burden, chronic stress, and unhealthy environment at the workplace. So first of all, we'll go to the psychological burden. That, as we all know, that it is very hard to juggle between both professional and personal life for the female. When the expectations don't meet, it impacts on the mental health of the female. And such a kind of stressful condition and social pressure that exacerbate the symptoms. So, as a part of solution or to overcome this psychological burden, we have to advise the patient for the healthy and balanced health for maintaining healthy and balanced life at both the spaces and not overburdening by peer pressure. Next, I will go to the chronic stress. It leads to the prolonged activation of the body like fight and flight response, and this causes disturbance in the hormonal hormones like FSH and LS, hormones and irregular menses, and to overcome this thing or to overcome the chronic stress, we have to do meditation or advice for the meditation and practicing gratitude. That has been a wonderful tool for overcome this condition like chronic stress. Next, we will go to the sedentary lifestyle. It leads to the lack of physical exercise and that results in the weight gain, and which disrupting the circadian rhythm and affect the metabolic health. And as a solution for this, we can be advised for the activities like yoga, walking, or any mindful physical activities. There are also some again dietary changes. Undoubtedly, it plays a very crucial role in cases of the PCOS because of the busy schedule, and that leads to the very unhealthy diet pattern or eating patterns. And it say that they say your body reflects what you feed. One can start mindful eating and experience how without any other medication it makes huge impact. Next, we'll go through the sleep disruption. They contribute to
Please
PCOS
continue.
in
Please
various
continue.
aspects. Okay, sir. Various aspects as follows. Firstly, how due to earlier causes the sleep cycle is affected, such as stress, anxiety, depression, or any lifestyle or mental causes. And that disturbs sleep leads to the hormonal imbalance, which increases the cortisol level and affecting metabolic function. And that causes abdominal fat, and that too worsening the insulin resistance. Now, next we will move on towards the sign and symptoms for the PCOS. There are irregular or missed periods, hyperandrogenism, PCOD, polycystic ovaries, obesity, hirsutism, acanthosis nigricans, acne, and infertility. Acanthosis nigricans, that is presence of dark velvety patchy, typically appearing in the body parts such as neck, armpits, and groin. And that is again due to the increased androgen level, which is due to the increased level of the adrenocorticotropic hormone (ACTH), which is associated with the deposition or stimulation of the melanin pigmentation, and that causes uh, dark pigmentation over the folds of the skin. Next, hirsutism, that is male-like hair growth on the face, chest, and back, again due to the androgen excess and acne. Next, we'll go to the pathology or understanding the pathology which develop in cases of the PCOS. That is, again, it is a disease of the ovaries, and here cysts are formed. That's why ovaries get enlarged due to the formation of the cyst and its increased volume. Again, stroma of the ovary, that will be increased with thickened pearly white capsules and presence of multiple follicular cysts, which measures about 2 to 9 mm in diameter around the cortex. Thickening of tunica albuginea takes place. These are at varying stage of maturation and atresia, and also causes theca cell hypertrophy. Next, we have to understand pathophysiology. As I said that there is no definite cause is present over here, but it is said to be that androgen excess is the main causation, or androgen excess takes place over here for the PCOD. So, how this androgen excess will be takes place? We have to understand by the understanding of the pathophysiology, and which covers some points like disturbance in the HPA axis, androgen excess, anovulation, obesity and insulin resistance, and long-term consequences. So first of all, I will like to go with the HPA axis disturbance. In normal cases, what happened that hypothalamus that causes release of GnRH, gonadotropic releasing hormone, which is transported onto the pituitary gland, and that causes release of GnRH, that means LH and FSH, in normal ovaries. But here, in cases of the PCOD, there is abnormality present in the HPO axis, that means hypothalamus pituitary ovarian axis. So here LH level is persistently high, and then the FSH. About the ratio is 3:1, and this persistent LH level causes stimulation of the androgen, and by this way androgen excess takes place. Next, here androgen excess itself, androgen excess occur by the ovary, adrenal, or systematic metabolic alteration due to P450C17 enzymes, which is a androgen forming enzyme. And here there is an abnormal regulation occur of this enzyme, and that's why androgen excess takes place, or androgen secretion increase from the ovary, adrenal, and systematic metabolic alteration. Next, due to anovulation, also androgen excess takes place. Like, first of all, we would like to say that here constant rising level of the LH, but decreased level of the FSH, low level of the FSH, and that will lead to the arresting of the follicular growth in different phases of maturation. Due to the low level of the FSH, follicles are not developed, and which do not increase, which do not produces the estradiol, and that results in the diminished estradiol level and increased inhibin production. And there is huge number of atretic follicles that contributes the increased ovarian stroma. Here, LH level is tonically elevated without any surge. So, all in all, we would like to say LH level is increased and FSH level is low over here. And due to the low FSH level, there is this diminished level of the estradiol. Again, next one is obesity and insulin resistance. Here again, obesity is also one of the causation for the occurrence of the PCOD. In which obesity increase adipose tissue, there is excess fat, and which produces pro-inflammatory cytokines, and that causes disruption in the insulin signaling, which causes insulin resistance. And in response to pancreas, that produces more insulin due to insulin resistance, and that increases the insulin in bloodstream, which results in the hyperinsulinemia. Here, so here I would like to finish all about the topic, like causation, its prevalence, pathophysiology, sign and symptoms. So, as we all know that whenever we have to understand the disease condition, we have to know all about the theory portion, that what are the causation, what are its prevalence, what why we have to understand this topic, and what are the causation, what are the sign and symptoms of the topic. So here I would like to finish all about the topic. Now next I will move on towards the homeopathic part, and go to the homeopathic management portion. As we all know that we are prescribing according to the totality of the symptoms in homeopathy. In homeopathy, we are prescribing according to the totality of the symptoms, and each individual that is different from one another. So we have to look after for the physical general, mental general, and constitution of the person. So here I suggest some rubrics for the PCOD from the different repertories, like homeopathic medical repertory by Robin Murphy. So we can able to take some rubrics from the repertory for the PCOD are female amenorrhea menses absence in young girls, that is Ignatia and X-ray. Journals, from journals, we can take about obesity general, that is uterine complaints with Calcarea cup, graphitis, Calica sepia. Cyst, ovarian cyst, Apis, bovista, bufo, colchicum, polocin, puja, tetina, iodum, calibrum, rustos, lycopodium, lachesis, and ovino. Next, left-sided cyst is calibich, podophyllum, silicia, and puja. From right-sided, it is Apis, Lycopodium, Podophyllum, Silicia, and Iodum. Some rubrics we can able to select from the Kane's repertoire by as follows, like genitalia female tumors ovaries, like Apis, Lachesis, Lycopodium. Female genitalia menses absent, amenorrhea. Skin discoloration, blackish. In that arsenic, sickle coat, plumbum. And next, general obesity, calcarea carp, capsicum, perum, graphitis. Some rubrics we can select from the heading striding symptoms of Armatia medica. That is genitalia female, ovaries, arnica, creosote, lycopodium, palladium, platina. Genitalia female, ovaries, congestion. Apis, belladonna, hemamelis, sepia, justilago. Genitalia female, ovaries, swelling, bufo, apis, phonium, hemamelis, iodum, lachesis, lilium-tick, justilago. Genitalia female, ovaries, tumors. Apis, eposinum, polocin, iodum, platina, podophyllum, lycopodium. And from synthesis, skin, hair, unusual parts on carcinosin, lycopodium, medorinum, puja, thyroidinum. Skin discoloration, blackish, aconite, antincrude, apis, argentum nitricum, arnica, arsenic, asafoetida. So here I would like to suggest some rubrics from different repertoires for PCOD. Here are some differentiating remedies for the PCOS. That is, first of all, we'll go to the Apis mellifica, that soreness and stinging pains, worse in right ovary, great tenderness over abdomen and uterine region, aggravation by heat in any form, touch, pressure, late in afternoon, after sleeping, in close and heated room, right side, emulsion in open air, uncovering, and cold bathing. Next, we'll go to the calcarea calf, which is best suited to the female, and constitution of the female is fat, fair, flabby females with scrofulous diaphysis. And here, meses is profuse with uterine polyp, aggravation by exertion, mental or physical, ascending, cold water, washing, wet weather during full moon. Next, puja, ovaritis, worse on left side at every menstrual period. Menses are scanty, retarded with polyp, leukorrhea, thick greenish, aggravation during night time from heat of bed, 3 a.m. and 3 p.m. after breakfast, fat, coffee, emulsion by left sided while drawing up a limb. Next, we'll go to the platina. Parts are hypersensitive, tingling present internally and externally. Ovaries are sensitive and burning present. Ovaritis with sterility is present. Aggravation by thirst, sitting, standing, evening. Emulation by walking. Ovinum, climatic disturbances and suffering after excision of ovaries, acne in females. Here I would like to finish some differentiating point between some of the uh, homeopathic medicine, and another one is Aristolochia clematitis, that is that has to be suggested whenever ailments occur from taking too much OC pills. And in today's scenario, today's world, there has been lots of patients who are taking OC pills and only menstruating. So we would like to prescribe Aristolochia clematitis whenever ailments occur from taking too much OC pills. Next one is pituitary anterior, that is indifferent, like sepia, don't want a physical relationship, avoid meeting people, discoloration on the face with acne on forehead during menses, cold sweat on forehead, aggravation before menses, relieved after menses, allergy from metals, and anger during ovulation. Murex, lively, affectionate, talkative, comparative, highly sexual desire, cross pain from right ovary to left breast, or vice versa. And now we will move on towards the case study. Uh, that a case of 32 years old married lady came with the diagnosis of the PCOS. She complained of irregular and scanty menses since 9 months and discomforting pain in right iliac fossa since 7 years after childbirth. She also complained of weight gain and severe hair fall. Pain was pricking in nature and which was relieved by pressure. That is the complaint of the lady, 32 years old married lady, menarche at the age of 12, and her cycle had now become irregular and scanty since 9 months. The flow lasted for 1 to 2 days and cycle was of 45 to 60 days duration. Character is dark brown, scanty, and offensive. Pain in the iliac region, especially right side during menses. Family history. All family members are healthy and alive. Personal history. She is married since 8 years and working as a senior manager in a bank. Physical generals. Appetite decrease. Heaviness after eating with flatulence. Desire for sweet and warm food. Stools, sometimes constipated. Perspiration profuse. Sleep on right side. Thermal hot. Mental generals. She appeared to be very dominating and said sometimes she is very artificial and not real in front of her boss because he is superior. These all are must to survive in the field. Here I would like to take some rubrics and repertorization. For the repertorization, mind affectation, mind elements from anger suppressed, mind anger contradiction from, mind anger indignation from, mind anger mistakes about his head, hair falling, female genital sex tumor, right side, general's food and drink, sweet desire for general's obesity, general's warm desire for warmth, and prescription is lycopodium, and that will be given for weekly and rubrum twice in a day. After 1 month follow-up, all these mentals are improved. Physical generals are also been improved, like hair fall that has been reduced, relief in the pain, appetite is also improved, and again prescribed lycopodium once in a week and rubrum twice in a day. And after 1 month, again, no more acne, menses again regular, generals are also improved, and mentals get relief. No more repetition of lipo is required over here. Next, we'll go to the case study. Second, a 20 years of old unmarried girl, and she complained of irregular and scanty menses since 3 months. There was heaviness of whole body as if swollen. Along with the heaviness, she mentioned sensation of heat, nausea, and vomiting during menses. She also complained about premature graying of hair. Her menstrual history revealed that she had her menarche at the age of 14 years, present irregular and scanty menses since 3 months. Cycle is about 2 to 3 days at the interval of 45 days. Bright red discharge is present. Past history, appendectomy done 6 years before. Family history, all family members are healthy and alive. Physical journals, appetite decrease, heaviness after eating with flatulence, desire for spicy things, stool, sometimes constipated, thirst decrease, like cold water, perspiration, profuse, sleep disturbed, unrefreshing, thermal hot. Mental journals, she is offended on the smallest matters, seems very jealous of her younger sister, looks, she cries sometimes without any reason, very talkative and loquacious, and delusion of the advance. Here I would like to take some rubrics for repertorization, like mind delusions, imagine phantom state, mind jealousy, mind loquacity, mind weeping, causeless, stomach thirstless, female genital sex, menses irregular, female genital sex, menses scanty, female genital sex tumors, journal swollen. And the prescription is Apis mellifica. Apis mellifica 200 weekly and rubrum twice in a day for 4 weeks. All off after 1 month. Mentally, she feels better. No prominent relief in nausea and vomiting. Menses as it is. Again, prescription is Apis mellifica 200 weekly and rubrum twice in a day for 4 weeks. And after 1 month, menses is regular on time. Quantity of flow is again slightly better. Sensation of heaviness of whole body. Relief in swelling. And prescription is Apis for single dose and rubrum for 2 weeks again. Last portion is management. There is a lifestyle modification. Here some sort of points for the management again. That lifestyle modification which help for the management of the PCOD cases, like lifestyle modification, weight loss, diet, exercise, psychological support, and avoiding stress. In cases of the lifestyle modification, it is the first line of the treatment. Even 5 to 10% of weight loss has led to the significant clinical benefits, improving psychological outcomes, reproductive and metabolic features. Weight loss is necessary because, as we all know that, and we have seen that obesity that is also causes insulin resistance, and which is also responsible for the occurrence of the PCOS. So, for the weight loss, there are many types of diets are also available nowadays. Like some diets which I'm naming, like Pilate diet, keto diet, once a meal diet plan, intermittent fasting. These all types of diets are also available nowadays, and for the maintenance of the weight, weight. Then a diet modification in the form of consumption of the food of low glycemic index and limiting carbohydrates. In cases of the diet like keto diet, there is a in that we have to take low carbohydrate diets and increase amount of the protein in the diet. Next, we have to also suggest for the aerobic exercise. Various kind of exercise are also available nowadays, like strength training, walking, jogging, swimming, and that has to be done for at least 30 minutes for at least 5 days a week. We have to maintain the healthy environment and avoiding chronic stress in the workplace, which will also help to prevent the prevailing incidence ratio for the PCOS. And now that is all about PCOS. I hope you all can understand for the topic and management for this topic. Thank you very much.
Yes, thank you, Doctor. It's a nice presentation. Professional one, very simple, looks very simple. At the same time, you have done a commendable job, I think. Time for discussion. Those who would like to participate, please raise your hand. You can have some questions, some discussions, or can make some additions. A lot of young, talented physicians as well as senior persons in the platform now. Kindly raise your hand. You have some doubts. Where you have mentioned about the introduction, what the difference between this PCOD and PCOS. Recently much discussed terms to separate entities are there. The more complicated one is the PCOS. You mentioned, right? Then the pathophysiology and clinical features and about the management. Now regarding the investigations, I think you left something. Am I right? No,
Yes,
not
sir. Yes,
no.
sir.
Yes.
That portion has been left. That investigation portion we have to include uh, hormonal assay, because there is a increased LH ratio and FSH decrease. Again, we will suggest for the USG, that will suggest for the follicles, formation of the follicles. And there is a one point is also the main, that is Rotterdam criteria, uh, which uh, which include that Rotterdam criteria. In these Rotterdam criteria, patient have to fulfill at least three criteria for the declaration or diagnosis of the PCOD, and that is first of all, irregular menstruation or late, delayed or scanty menstruation, oligomenorrhea is there. Minimum 12 follicles are present, high androgen levels, which is supportive, which causes acne, hirsutism, and all. So patient is to attain minimum three criteria for the diagnosis of this PCOD.
Yes, that's most important. Minimum 12 follicles may be there to discuss, to describe as this
Yes, sir.
polycystic ovarian disease. Then you mentioned about anybody would like to participate, please raise your hand. The complications, especially the
Yes, sir.
PCOS.
Complication.
So it indicates the importance of a comprehensive case taking. Yes, cardiovascular complications may be there. The endometrial complication can be there. Then the type 2 diabetes. So the totality is what is more important, isn't it? And
Yes, sir.
moreover, while we considering the exciting causes are the real cause of disease, but homeopathy never agrees with that. So these are only exciting causes. If the miasmatic background is there, the patient will act. The conditions will act on the patient. Then you last mentioned about avoid chronic stress. How it possible, doctor? What do you mean by that?
Chronic stress, that means
Yes.
nowadays it is um, for the female. It is very difficult to maintain household work as well as on the professional life. They have to balance, and that will cause it stress, continuous stress or pressure for performance, and that will result in the chronic stress also, and that also impacts on the menstrual cycle of the female.
Yes,
And
that
most
yes,
probable,
I am agreeing that my question is that you advise that avoid chronic stress. How is possible? How can you avoid? Include yourself. How can you avoid this chronic stress?
so we have to do
Dr. Ram
as
Parmeshwar, what is your answer? Just Dr. Ram Parmeshwar, what is your answer? Do you have any remedy to avoid this chronic stress? It's an experienced person. The service.
Thank you, Dr. Manoj. Congratulations, Dr. ROZMI Tajni Madam.
Thank you, sir.
Very nice presentation. Knowledgeable presentation. PCOD and PCOS. Due to there are three engineering: electrical engineering, and chemical engineering, and mechanical engineering in the body. So, due to PCOD, electrical engineering disturbance. Electrical engineering is called name of lifestyle disturbance. Electrical engineering disturbance produce chemical engineering hormonal disbalance. After produce ovary other disease, female disease, and chemical disturbance, hormonal disturbance after mechanical disturbance, yani body organs disturbance. So PCOD is a very important role of miasmatic, flora and psychotic background. So very thanks. Many kinds of medicine deals, APs, Thuja, etc. So very thanks, Madam ROZMI Tajni Madam. Thank you.
Thank you, sir.
And we mentioned about the important medicines that are indicated for such conditions. The most remarkable, noticeable compound is the polycyst. They are the most
Yes,
indicated
sir.
in all cases. Then you treated two cases beautifully with lycopodium and epismel, that too with minimum dose in the shortest possible time. It indicates the Hahnemannian principles, the medications, the formulations, even after 200 years, still working. But usually what happened is that when we fail to select a remedy, we accuse homeopathy. It is 200 years old. We need some sort of modification of the principles of homeopathy. But if it succeeds, we never accuse us. If it fails, we often accuse any man. Now, Dr. Sergi, are you there? If she's not there, anybody would like to participate, please raise your hand. Hariharan sir, what is your opinion? What is your experience on this polycystic ovarian disease? Hariharan sir. Yes, Dr. Binduraj raised hand. Dr. Binduraj, please. Yes.
Hello, Dr. ROZMI. It was an excellent presentation, short and crisp.
Thank you,
And
sir.
in epidemic proportions, PCOD and PCOS is on the rise. And with great homeopathic management and all, we can sure make some difference. Not some difference, vast difference we can make. And it's the ray of hope homeopathy can provide. And Dr. ROZMI narrated well. The theoretical and practical part is great. Thank you, Dr. ROZMI.
Thank you, sir.
Okay, thank you, Dr. Binduraj, who is always promoting or working hard from the classical homeopathy. Thank you, Dr. Binduraj. Now, Dr. Munira. Dr. Munira, please unmute. Dr. Munira. Yes.
Hello, sir.
Yes.
Madam, very nice explanation about PCOD. I myself, Dr. Munira Valikarimbal, I am the colleague with working in Samlaji College with Dr.ROZMI ma'am. And I am also I am also practicing homeopathy, sir. Very nice presentation of the case, ma'am, and very nice explanation regarding PCOD. In PCOD, one thing I will like to share my experience of the
Yes,
case.
please.
That always Master Hanuman says that in the chronic cases, as per our organon, we have to investigate the Sura history. So the conflict of the patient is very important from childhood. It starts, according to my opinion. The case which I had cured in PCOD, the conflict was childhood dominating of father, and that it progresses when she married. Also, there was domination of the father-in-law, and in every chronic cases, we have to consider the disposition of the patient, and that disposition I took in my case, in which I had prescribed that girl Natrum sir. So
Yes.
that was also very nice, cured in that case. So I think personally, I think whatever the case in chronic cases, disease is not important for us. As a homeopath, we treat a person, not a disease. So every chronic case, we have to investigate SORA, starting from childhood up to the present situation. And for that, we have to, if we are better to pick up a disposition, we can surely cure our case.
Yes. Okay.
So that depends on the case, that what kind of a patient or patient came with the history. According, we have time limitation to mention this predisposition. So whatever we I sorted it into the rubrics form, that mind in cases of the lycopodium. I have to take the rubric like affectionate, and that is a very elaborating form. So with the time limitation, it is very it is very difficult to mention for me.
Yes, but very nice presentation, ma'am. Both the case were very good.
Hello. Hello.
I think there is a technical problem. Let's wait for a while. Dr. Manoj, we need to find.
Yes. Yes.
Yeah, doctor, are you okay? Are you there?
It always disturbs us. The communication, the connection, the network is always. Am I audible?
Yes, yes.
Yes.
Unfortunately, the network is again creating problems. So, as rightly mentioned by Hanuman, the exciting cause and maintaining all these will operate once the miasm is there. He got he as the example. He was not affected the Sora, so there are a lot of exceptions and problems in his.
No, just start going.
If anybody would like to participate, please raise your hand. We have 2 minutes remaining. Audio disturbance is there. I am now inviting Dr. Bob Lim to have the comments as well as
Hello. Dr. Manoj.
It seems there's some network glitch. And on behalf of IFPH, I thank Dr. ROZMI MEMON and Dr. Manoj who moderated this session. And thanks for all who presented in this session. Over to Malayalam, Dr. Shaila, for continuing the Malayalam session. Thank you all.